The FIFA Men's World Cup starts tomorrow, and the U.S. expects between 5 and 7 million visitors across its 11 host cities. FEMA has allocated $625 million to those host cities for security preparedness, but none of it was designated for public health preparedness. And some health officials are concerned about the potential health risks of mass gatherings. They warn there is no dedicated federal public health response team for the tournament. So it comes, of course, as the World Cup is happening in the midst of this global Ebola emergency. The CDC says there are 550 confirmed cases and 101 confirmed deaths, although there have been no confirmed cases in the United States. So let's bring in CBS News medical correspondent Dr. Céline Gounder. She's also the editor-at-large for public health at KFF Health News. Céline, good to see you as always, although this is incredibly troubling. So why is there an event of this scale, the amount of people that are expected to come to the United States from all over the world? And it's not just where they're coming from, it's who they may have been exposed to even before they get to the United States. Why is there no centralized public health team appointed to the World Cup?
Great question. I don't know that I can answer the why, but I can tell you what is happening. So FEMA, through the federal government, has allocated $625 million for security. So we saw, with the NBA finals, of course, you need physical security and law enforcement, but that is not the only threat at hand here. Zero has been allocated for public health preparedness. And so you're having universities stepping into the breach. Georgetown University has stood up a health surveillance operation, collaborating with others around the country. Host cities have formed a voluntary wastewater surveillance network. We're actually seeing measles already in Kansas City wastewater. But there's no enforcement authority. So even if you know something's happening, is there the ability to marshal resources, boots on the ground to respond? Unfortunately, there is nothing new specifically for the tournament.
Wow.
And Dr. Gounder, you've written 2 articles about this, one in Sports Illustrated, another one is on your website. Tell us, what's at stake and how people can stay safe, because people are going to be going to these events and then they're going to be circulating throughout the country and on public transit.
I think this is why it's even more important for people to take responsibility in this moment, because we don't have the public health system there to back us up if something happens. So make sure you're up to date with your vaccinations. I mentioned measles in the Kansas City wastewater. We know we have pockets of under-vaccination throughout the country. There's lower rates, particularly among children in certain areas. So, if you're bringing your kids to the matches, make sure they are up to date with their vaccinations, especially measles. You're having people sitting outside in the heat and sun exposure. So making sure you're staying hydrated, that you're wearing sunscreen. There are parts of the country like Houston, for example, where you have mosquitoes that can carry various different infections that way as well. So wearing insect repellent with DEET or Picardin. Washing your hands. We've seen norovirus outbreaks at these kinds of events. And then if you're sick, stay home or stay in your hotel. You don't need to be bringing a fever to the stadium. If you do need to see a doctor, be sure to tell them where you have been. Travel history can be really important here.
So what can we learn from previous World Cup events about why and what kind of health response is necessary? Other countries have been able to get through the World Cup without mass outbreaks. What can we learn?
Well, what is normal for these kinds of events, whether it's a religious pilgrimage like the Hajj or the World Cup or the Olympics, where you have millions of people from various different countries assembling? It is predictable that you're going to have something happen. It's not hypothetical. It is predictable, which is why you should be investing resources to be prepared. In the Hajj, we had over 1,300 people who died from extreme heat exposure. Milan Cortina, the Olympics, we had a big norovirus outbreak. So what you normally would have would be a centralized incident command center. Kind of like, public health is a lot like the military, actually. It's a chain of command, and where you coordinate, you track what's happening, and then you move resources quickly and respond when something happens. And unfortunately, we're not set up to do that this time.
All right. Still so hard to believe. Dr. Gounder, thank you so much for shedding light on this and telling everyone how we can protect ourselves given the lack of an overarching system. Thank you so much.